Is your partner up and down all the time? They seem addicted to chaos. Many times people will tell me that their partner is bipolar, but they've really never had a diagnosis, but they'll just say they're bipolar. Or they'll say, oh, I'm having a bipolar movement or moment. And although that's not ever something you should joke about, a lot of things that are called bipolar are not bipolar at all. And I'm going to talk about borderline personality disorder today. And although it used to be called chaotic personality disorder, which probably describes it better, the DSM-5 now calls it borderline personality disorder. And I want to tell you, when I get a person with this diagnosis, I'm very respectful of what I can and can't do, and I usually end up referring them because they are very difficult to work with. And borderline personality disorder doesn't go away. It's a personality disorder, and they're specifically more difficult to manage and to treat because it's within the person's personality. It's not just a chemical per se, like perhaps bipolar you can control with different medications. You can make it, you can ease it. With borderline, it's not like that because most of the time the clients won't take the medicine. They're not self-aware, and they really have so many issues that get in the way with that. If you're married to a borderline personality disorder, I don't think you can sustain the marriage without a professional healthcare worker. I think you're going to need a counselor that you are seeing religiously, monthly, so you can talk to them because it's very difficult being the spouse of a borderline personality disorder. I'm going to go through how it looks, but the first thing I want to tell you is when you have a borderline personality disorder spouse, or girlfriend or boyfriend, it's important to understand their brain is like a sponge. It's got a lot of holes in it. And it absorbs. The reason it can absorb so much of its surrounding is because it actually is porous, and it just continues to suck in whatever is going on in the environment. And many of them will say, I feel empty, or I feel sad when you talk to them. And you understand that although they're saying this, and this is self-awareness, they're reacting to what is going on around them. If you were to look around and be with the people they're with, you would see that they would once again absorbed that situation. No matter what situation they're in, they're going to absorb it and they are going to become it. So I'm going to give you this list. I think it's important you listen to it and talk, if you're in a therapy session or you have a therapist, that you talk with them about it so that they'll be able to guide you and help you further. They have a constant fear of abandonment. They are worried from the get-go, and many times borderline personality disorders grew up in chaotic homes. So they're always worried they're going to be left. They're going to end up with no one. Security is a big deal for them, but they make it almost impossible for someone to make them feel secure. They have a love-hate relationship with their partner. They will love you one minute, and the next minute they will be cussing you out. They will hate you. When things are going well in your relationship, they'll flip it upside down and make it unwell. They need chaos, and they fuel themselves on chaos. And it's important you understand that if you're with them, you are going to be in a chaotic relationship with them. Thirdly, they can't separate themselves from others. So this may happen in a relationship, it may happen with children, it may happen with anybody. But basically, if you're sad, then they're going to be really sad. If you're happy, They'll be so happy, they'll almost be on the manic side. And it's easy when they're dating to go, oh my gosh, this person is completely aligned with me. Like when I'm happy, they're happy. When I'm sad, they're sad. Because there's a lot of romance movies about that. This is not a romance. This is unhealthy. Because when you're upset, you need a base. You need a stable rock. If you're angry, you don't want somebody else that starts shooting at people or cussing people out because you're angry. You want someone to hold the line and say, well, wait a minute. Let's think about this. Let's go through this. And you can't do that with a borderline, because if you were to do that, they would flip into one of their paranoias or their hateful things, and you would become the target. They're impulsive. They do self-damaging behaviors. They can be abusive, not only to themselves, but to others. More likely, when they're angry, they're going to reach out, they're going to do something to themselves. Many of them cut or do something that's so dangerous. They put themselves in harm's way because it's a form of punishment. They have a lot of inside emptiness, a lot of inside sadness, and just terrible feelings of being wrong, being ashamed, being, an outsider. So you always have to understand they're very hard on themselves. They have a lot of those thoughts that continue to go through them all the time. They have a lot of suicidal threats. They make a lot of threats. They make attempts. They usually don't go through with it, although I even hate to say that because some of them do, but they will try to scare you. They'll do things in front of you. Somewhat, it gives the appearance of being staged, but at the same time, you need to take it seriously. You need to know these are cries for help. This person does need to seek medical attention. They need to see a mental health care professional. Don't ever tell yourself, well, it's not a big deal, they're just faking it again. Because although they like a stage, they like an audience, they can go through with it because they have a lot of negative thoughts, irrational thoughts, and a lot of just quick, impulsive energy that they act on. They're extremely rapid to become depressed, anxious, and just totally at wit's end. So you may be talking to one. They'll come into my office and I'll be talking, and all of a sudden they'll flip into this most depressed person. They can barely get up off the sofa. It's not faked. It's who they are. It's what's going on in their head. And it's something that you can't solve. It is a mental illness. It is a personality disorder. You have to take it seriously. And they go into cycles of this, episodes. They're not that way all the time, but they can become that way. And if you are married to them and you don't know it, it's frightening. I told you that they were many times, they are empty. They feel void of anything. And once again, that goes back to their sponge-like. They're just the whole metaphor of what they're doing. They're absorbing things. And if they tell you, I feel empty, I would seek their surroundings, because more than likely you're going to find out why. They have a very rapid onset of anger. They can be reasonable and be talking to you and flip out. I have seen these people do incredible things. They should never have a weapon. You should remove knives and things like that from any area that they could get at, because they will use them, and they will threaten many times, but then not only will they threaten, they will carry through. So when they escalate, they do so quickly, and it's on a dime, and you shouldn't blame yourself, because it's not about you. It's something they're absorbing from the environment that they put through their mind, and this is what they're going to do. And lastly, they have a lot of paranoia, and it's self-induced, and this is how it happens. Their paranoia comes when you say, you know what? You're acting like you're having one of your episodes. I can't take this. We're going to go to a psychologist. We're going to talk about this. And then what happens is, because you confronted them, they cannot deal with it because it's not their truth, they become extremely paranoid and they begin telling themselves a story that you're trying to lock them away, because remember, they have abandonment issues, that you're trying to get rid of them, that you never loved them anyway, and at that point they can get harmful toward themselves, toward you. And so if you're going to confront them, it's important that you already have a backup plan, where you're going to take them, that someone is going to receive them on that end and help them. A mental health care worker, like I told you in the beginning, that you're working with is an optimal person to have ready when it comes to a time when you're going to confront them. Confronting them helps. Usually they'll get the treatment, they'll go for a while, but they will drop off again. It's a very frustrating cycle, and one that many couples have tried to go through. But I will say the ones who are successful have had a therapist on call that they can work with. They can, borderlines have a lot of difficulties, but it's important you understand where they came from and what the diagnosis is before you decide what you're going to do. I hope this helps you, and good luck.